My name is Bob Roper, and I am a prostate cancer survivor. I'm in my early 70s, and I became aware of the problem in early 2016. I had not had a PSA test for a while, and because of an unusual set of circumstances, I had that test.
The testing is PSA testing. P stands for prostate, S for specific, A for antigen. An antigen is a protein. This one happens to be made specifically by the prostate. So when the levels are elevated in the body, it means that there's extra prostate activity, and one of the things that can cause extra prostate activity is prostate cancer.
I had that test, and one checkup led to another, including a biopsy, and ultimately found out that I was at risk of the prostate cancer getting beyond the prostate and in fact getting into the rest of my body, which is a very bad diagnosis to get. So in April of 2016 I had the prostate removal. It's called a prostatectomy, and I'm pleased to say that ever since my blood work has been with the PSA test has shown that my level of the PSA is 0.00, and of course that's perfect. That means there's nothing there.
People who get PSA testing early and manage to detect prostate cancer in their early stages are shown to enjoy 50% more life years on average with treatment than people who are discovered to have prostate cancer when symptoms emerge, or they just happen to walk through the door and for the first time they're found to have an elevated PSA. So screening really is valuable in terms of early detection, and early detection has been shown in multiple studies to be really valuable in prolonging survival, if not curing the disease.
I continue to be monitored about every 6 months and ultimately every year, but I think I can now happily say that I'm cancer-free, and if I hadn't availed myself of the PSA test and further testing, I probably would have had a long-term problem.
We recommend testing occur once a year, and the recommendations have been that the testing start occurring earlier and earlier, because what appears to be clear from the research is that the earlier that you get tested, the sooner you can stop testing when you get older, and the more likely it is that you're able to catch prostate cancer in its early phases and actually give people extra life years, or maybe in some cases even manage to effect a cure.
Now I feel very good about my life trajectory from now on, and in addition I feel very good about the decision to have that test and pursue it after not having done so for a couple of years beforehand. That's why I'm willing to tell this story.